I am Dr. Kevin Hanson. I'm an assistant professor with the Healthcare Administration program, and the course is IDIS 201, Overview of the United States Healthcare System. Remember, we talked before about how far should you have to go to get healthcare. If you're pregnant and you're about to deliver, ladies, how far is too far to go? If, for where I grew up, a lot of people had farm accidents where they lost an appendage. How far is too far to go? And also think about if somebody has to come to you, AKA like an ambulance, and then take you back, how far is too far to go? What we do is we explore the healthcare system, and we go through a historical perspective of how the healthcare system used to be, and then we eventually get up to how it currently is structured. And so that's kind of the first part of the course, is understanding how healthcare is structured. Part of that also is learning how to create healthcare policy. So we go through a lot of the policy making process, how to create policy, figure out who it's going to impact, what stakeholders you should have at the table that might have a favorable opinion or an unfavorable opinion, and then what the ultimate outcome of that is and the policy. And so that's kind of the first part of the course. And after that, then we move into more segments of the healthcare system itself. So we talk about mental health care, acute care, so care that's in hospitals. We talk about long-term care, so care that's in nursing homes and assisted livings. We talk about healthcare around the world, so we kind of evaluate how different countries do their healthcare systems. We get to, what else? We talk about the Affordable Care Act, or Obamacare. I don't love Obamacare, but we talk about the Affordable Care Act, and we talk about other policy proposals that have been done in Congress. We also talk about some ancillary parts of the healthcare system. So we talk about leadership and management. We talk about information technology or healthcare systems and electronic medical records and electronic health records. And eventually I have you guys, which we'll probably talk about in a second, but you also will do some independent research on the healthcare system on things that we don't get to talk about, like transitions of care between, say, acute care and long-term care, or long-term care and people going back to their homes. The typical lecture setup, I usually start with a little beginning session that introduces you to a new policy that you may not have heard about, or a new function of the healthcare system. We dig in then to whatever the lecture topic is for the day. It might be about public health efforts, how we assess people's health and their willingness to change their behaviors, or, like I just said, the ideas of Medicare and Medicaid or other segments of the healthcare sector. Usually I am lecturing, but there are days where we do some small group work, especially when we're talking about how you develop policy. I give out policy scenarios to individuals, and then small groups get together and work on that and formulate a policy and decide what should be done, should not be done, who should be at the table. And so there is some small group work on a few days. I do take time in the class to also review for the exams. We play Jeopardy and have a little bit of fun, have a few quotes about Britney in there somewhere, right? But we try to have fun, but we also try to do a little bit of small work. But the course is a lot of lecture, and then sometimes you are processing the lecture through discussion board posts after the fact as well. I would like students just to have a better understanding of how healthcare works in the United States. The system that we have in the United States right now is very complex. We have care for veterans that's paid for and structured a certain way. We have care for the elderly or the 65 and older population that's structured for and paid a certain way. We have care for the poor and disabled that's set up a certain way. So it's my goal in the system to make sure that people understand all of those different perspectives and all those different ways that healthcare can be provided, paid for, and accessed by individuals. And so we do spend a lot of time talking about access to care, the cost of care, and the quality of healthcare that people get. And that kind of filters its way throughout. So I do hope people understand the policy making process after the class is done, but also how that works inside the healthcare system. And so again, the way we do exams, papers, group projects, discussion boards, all of that set up to help people really understand our healthcare system and understand if we changed one thing, how that might affect a whole bunch of other things as well. So overarchingly, I hope people enjoy the class and have fun. We try to have a little bit of fun, and I make jokes here and there. I think I'm semi-humorous, but the ultimate goal is that people understand what we've had in the past as a healthcare system and what we now have and what we're moving towards, and how to make good policy, good informed policy, especially as it relates to healthcare in our course.